Hello, I am Dr. Shashank Joshi. You are watching the 427th episode, the non-stop edition of Dr. KK's MEDTalks. Let's have the headlines for the day. So you know that there is a pediatric wave of COVID in the US. In fact, 25% of the COVID cases which are diagnosed in the United States are COVID. Last week alone, 243,000 children in United States were tested COVID positive. This is the second highest week for pediatric cases, according to the American Academy of Pediatrics and the Children's Hospital Association. We also now know that the WHO is anytime likely to accrue Covaxin, as per Dr. V.K. Paul, the Niti Aayog and head of task force. India, in the 75th year of its independence, has had a world record 75 crore vaccines as far under the national vaccination drive, and 57 crores of these have been vaccinated with the first dose, and around 18 crore have got both the doses. So around 18.5% of our population now has probably got both the doses and are technically fully vaccinated. It is expected that children between the ages 12 and 17 with comorbidities may be able to get vaccinated between October and November, when the Zydus Cadila vaccine will be available for them, which is the world's first DNA vaccine. There has been a clear decline in the last week to this week. In fact, Maharashtra is out of the top 5, and the 5 southern states and the Union Territory of Pondicherry, they have recorded 2.5 lakh cases. Kerala still leads with around 1.7 lakh infections. Tamil Nadu followed by 11,000, Andhra Pradesh 8,800. And whereas the total case count in 14 states and Union Territories in North and Central India was only 3,000. Today's topic for discussion is COVID immunity and vaccines. What's new? And let me introduce our guest speaker today, who has always been with us for the Jopa show, Dr. Rahul Pandit. He's my very good friend. He is the Supreme Court attached task force member for COVID. He's also a very, very active member of the National Maharashtra Task Force. He is the director of critical care for the whole Fortis group, as well as he has been very actively involved with evidence-based work related to critical care and COVID. And he has pioneered the work on the 6-minute walk test of oxygen saturation. Rahul, my first question to you on this very, very important topic is, how long will the immunity from vaccines last? Is a question everybody is asking. And what is your final take on COVID immunity and COVID vaccines, the topic for the day?
Good evening, sir, and thank you very much for introducing me kindly. And as I always say that you get to introduce me, but I rarely get to introduce you, so I'm going to introduce you again. Padma Shri Dr. Shashank Joshi is a renowned endocrinologist who has been the face of the Maharashtra Government Task Force and has had more than 600 publications to his credit. And he keeps on doing original scientific work. And his Man Ki Baat with the Honorable Prime Minister earlier this year was very well appreciated, even by the Prime Minister. And the words of Prime Minister were that "Aapki vicharo ki saralta mujhe pasand aayi." So I think that sort of sums up the whole of Dr. Joshi in one sentence, which the Honorable Prime Minister said. Coming to the question posed by Dr. Joshi, sir. So we know there are two types of patients here. So one group of patients is who have taken 2 vaccines, and the other group of patient is those who have had COVID either before the first dose or between the 2 doses, and they have taken the 2 vaccines. So we know that the immunity may probably last somewhere between 9 months to 12 months is what most vaccine makers are saying. But it's not just the immunity which we are worried about. We have to basically look at the T cell response as well. And the T cell response and the neutralizing capacity, we now know that in patients who had COVID plus have taken 2 vaccines is far better than people who've just taken 2 vaccines. Again, each and every individual is different, and the decay in antibodies in them, even those produced by the vaccine, may stay for a long time. We are not really sure whether all group of individuals can be clubbed into this 9 to 12 months population, or we probably need to wait for some time longer. Also, the research on when the booster dose or the third dose should be taken and how long would that give immunity is still a question and work in progress. and we would probably get to know a little bit more about it in the days to come, specifically for the virus, for the vaccines which are available in India, the Covishield and the Covaxin. However, we know that the vaccines are giving us reasonable amount of immunity, and that is being elicited by the fact that those patients who have taken vaccine and have contracted a breakthrough infection or a COVID infection, as we call it, after the vaccine, they have a milder disease as compared to people who are not vaccinated. And the milder disease is essentially a part of the process which we call as where patients don't need to be hospitalized or do not go on to progress into requiring oxygen or intensive care. So that's my take, sir. If you have a different take on the time at which the antibodies decay, our viewers would love to hear that from you as well, sir.
No, no, I completely agree. So the modern concept of COVID-related immunity is hybrid immunity. If you have developed natural COVID infection, usually the immunity is expected to last you for 8 months to 1 year, the humoral bit for 8 months, and the T cell bit for at least a year. That is the current thinking on the COVID vaccination front. So that is how things are. B cell immunity is concerned. That is something which is very well documented, because we can actually measure different types of antibodies, like the nucleocapsid antibody, the RBD antibody, the neutralizing antibody. As far as the T cells are concerned, they are not clinically measurable. Only in research setups they are studied. Now, as far as vaccine-induced immunity is concerned, that has a different connotation altogether, as Dr. Rahul very beautifully explained. And usually after the 2 doses of the vaccine, it takes around 14 days to develop antibodies. And we don't know whether it lasts for 3 months, 6 months, 1 year. That's an unanswered question. Remember, COVID vaccines are the fastest developed vaccines on planet Earth. We never knew anything about this disease. People have taken years and years to develop vaccines and antibodies. So obviously it takes its own sweet time. So right now, whatever knowledge is based on emergency use authorization of various vaccines. There are two big questions, Rahulji, which everybody is asking. One is, should we get a booster shot? My personal take on it is, if there is a immunosuppressed situation or immunocompromised situation, probably there may be a merit in the third dose. But currently we have beautiful monoclonal antibodies available in affording population for them to save their lives in the vulnerable group. Currently the public health and WHO has not recommended the booster dose for the simple reason is that we want to give the vaccines to most of the people. But from a science standpoint, probably immunocompromised host is a compelling reason for people like transplants or people like what we see Dr. Rahul. So what is your thoughts on the third dose or the booster dose?
I think it's a very pertinent question, which I must confess it does come across my mind as well. But let's talk a bit of science and then a bit of equitable distribution. So, from the science point of view, as you've already rightly said, sir, that the studies are not adequate for us to compellingly actually ask for a booster dose to be taken for general population. However, we have some merit in people who have a poor immune system, and that poor immune system could be because they have a disease which is causing it to go weak, or they are taking some medicines which we call as immunosuppressive medicines. So a immunocompromised host who is maybe a cancer patient, a blood cancer patient, a solid organ cancer patient who is on some chemotherapy, or somebody who is on steroids for a rheumatoid problem or some autoimmune problem, those would be the patients who are expected to mount a poor response. In them, we could possibly give the third dose, and that third dose will definitely help them, because their ability to mount the response is less, so their ability to fight the infection is also much lesser. And hence, if they are going to be in a situation where they contract COVID after 2 doses, they are likely to be in that serious category of patients who would probably require hospitalization, even intensive care, and a danger to the life. The second thing which I said is equitable distribution. When we actually have a large chunk of population still who haven't had their first dose as well, and mind you, this is not a criticism of the government at all. In fact, government is doing a fabulous job immunizing 1 crore people every day. On an average, we have been giving almost to the tune of 15 crore doses in the last 20 days or so. I think we have to be cognizant of the fact that our population is large, and a large population takes some time for them to be vaccinated fully. And as I said, this is not a complaint, or this is not a criticism. This is in fact appreciation that we have done almost 75 crore doses now, much higher than any country in the world by several folds. Probably China might be the only information which we may not be having correctly, but the rest of the world, I think we are much better. And if you don't have first dose given, it is not probably reasonable for us to be asking the third dose. In the meanwhile, sir, I would like to just talk about two things, if you agree with me. That vaccine is there, of course, but mask is a very, very potent vaccine. And if you can wear your mask properly after two vaccinations, please wait till the NTAGI and the government of India approves officially for a third dose to be taken, so that you can have it on the COVID app. When everybody else will be eligible for it, you can be eligible for it as well. So don't worry about that. Till that time, mask up. And if God forbid you do get into a problem, then you can actually take up the monoclonal antibody which is available right now, which has shown to have good amount of immune response. While I think Sir joins, I will basically talk about a few questions which have come in. So Debelina is asking a question that is it safe for domestic travel at the moment, train or flight, which is safer? So Debelina ji, it is, if it is a compelling reason to travel, I think you can travel safely after vaccinating yourself with two vaccine doses and 15 days past the second dose with complete COVID appropriate behavior. A train or flight, whichever you choose, you have to basically make sure that you have a very, very tight control over your mask and you don't take out your mask. In that case, a flight might be actually easier. There is a study, a recent study, which showed that if you have good COVID appropriate behavior and you had patients who were doubly vaccinated who had boarded the flight, the risk of transmission in the aircraft is extremely low, extremely low. It makes you feel a little bit better that hardly there are any patients who are actually getting COVID-19 because of that. So my suggestion would be that wait for your vaccination to have at least 2 weeks after the last dose or second dose of COVID, and then the second dose of Covaxin, and then you can probably take a travel if it is compelling. If it's not compelling, I think there is no need to travel right now. So the leisure travel, the other means of travel, if it can be avoided, you should probably avoid. But if somebody has to work and has to have some important job to be done for travel, by all means, there are the things have opened up now for people who want to have a compelling travel. Another question is from Manpreet ji. Manpreet ji says that I've got my antibodies test done after getting COVID. It was 2.49. This time I had not taken any vaccine. Now I've taken both doses of vaccine. Any measure of antibody to understand the level of antibodies? So Manpreet ji, there are a lot of commercial antibodies which are being marketed right now. The common ones are the receptor binding antibodies, as well as the nucleocapsid antibodies. And what I would suggest is that don't go for an antibody test. It's not going to make any difference. You don't have any other chance of taking a vaccine as a third dose right now. So right now, the best way is that you trust your body's immunity, that the immunity is good. And if you're an immunocompetent person, if you're not on any immunosuppressive medicine, or you don't have a disease process which makes your immunity weak, trust me, you would have enough antibodies to protect yourself, along with the mask, along with your social behavior in terms of your COVID appropriate behavior and wash and hand hygiene. So there is no substitute for that, unfortunately. Veena Rashmi Karnawat is asking, how is it that in UAE, one of my acquaintances is supposed to take a third dose? She's 70 plus. Well, right now, as I mentioned, Rashmi ji, there is a large chunk of population which has not completed even their first dose. And a lot of research about the vaccines available in India, which is the Covaxin, Covishield, Sputnik, which are now commonly used, and then the other two which are going to come up very shortly. We don't have enough data right now to talk about a third dose, whereas Pfizer has got certain data, and UAE is a place where a majority of the people have been vaccinated with Pfizer. So I think we just need to wait till our NTAGI and have some faith on our government that the NTAGI would give a green signal when they feel it's appropriate to be done. And I think the need for a third dose is just not there right now. I'm very, very clear. वीणा बेदी जी आस्किंग, हस्बैंड को स्पुतनिक के सेकंड डोज के 5 दिन बाद दोबारा कोविड हो गया है और उनको बहुत सी बीमारियां निकल आई है जो पहले उनको नहीं थी, जैसे शुगर, बीपी और हार्ट प्रॉब्लम। वीणा जी, दो चीज़ें कहूँगा। आई विल से 2 थिंग्स फॉर यू। सबसे पहले तो कि जब तक आपके दूसरे डोज के बाद 2 हफ्ते नहीं हो जाते हैं, तब तक पूरी तरह से अपनी बॉडी जो है क्षमता और इम्यूनिटी नहीं दिखा पाती है कोविड के अगेंस्ट। तो सबसे पहले तो ये बात है कि 2 हफ्ते नहीं हुए थे, सेकेंड डोज के बाद 5 ही दिन हुए थे। दूसरी बात, उनको जो बीमारियां आप जैसे बोल रहे हैं, तो शुगर काफ़ी बार कोविड की वजह से ही बढ़ जाती है। स्ट्रेस और इसके वजह से बीपी का भी कभी कभी इश्यू हो सकता है। और अगर हार्ट प्रॉब्लम डॉक्टर बता रहे हैं तो उसका क्या इलाज है वो आप ज़रूर डॉक्टर से बात कीजिए। स्वाभाविक है कि वो इसका पूरी तरह से निदान करके ही आपको जो है इलाज बताएंगे। एक्यूट और एक्टिव कोविड में सिर्फ इमरजेंसी जो चीज़ें हैं वही ट्रीट करनी चाहिए। अगर कुछ चीज़ें रुक सकती है कोविड के कुछ दिनों बाद तक तो बहुत अच्छा होगा। इतना मैं कहूँगा। सर, thank you very much. Again, 2 questions for you. One is, we talked about the booster dose and we talked about the monoclonal antibody. I want to now ask you to throw some light that if at all a booster dose is taken, and there is a lot of research which has been done on this topic, but we don't have enough concrete data about mix and match vaccines, heterogeneous vaccine as a third dose. So, do you think that this would become a reality, that we would probably be going in for a heterogeneous vaccine because it may be producing better antibody response than just the same vaccine taken? That's the first thing. And the second thing is a little bit about monoclonal antibody. You mentioned that those who have got third dose, those who may not have taken a third dose but are immunocompromised, monoclonal antibody could be given to them if they contract COVID. Is there a role for prophylaxis for monoclonal antibody in this group?
So Rahul, let me take your second question first. US FDA has approved prophylaxis for immunocompromised individuals with monoclonal antibodies. They are expensive, they are not easily available, but in such high-risk situations, if this is a vulnerable group which is likely to get exposed, that is a possibility. But a cost and the free use and the ready availability is a rate-limiting step for the easy use of that. Your first question is, mix and match was done for the first 2 doses for full vaccinations, which means some people took Pfizer or Moderna first and then took Covishield. Some people took Covishield first and then took Pfizer and Moderna. So that type of first dose, second dose, mix and match happened. In India, accidentally what happened was some people took Covaxin first and then they took Covishield in Gorakhpur. And this was published as an anecdotal report by ICMR. This is all for the first dosing. But after completing somebody, that is full vaccination, adding for the booster dose, a mix and match, has not been studied in public domain. These studies are ongoing. It's a very, very attractive hypothesis, and it stands to logic that this can happen. So I personally feel that such studies will occur. There are 3-4 basic platforms of COVID vaccines. One is the mRNA platform, which is Pfizer and Moderna. They document, they say, a lot of neutralizing antibodies, but may not be very robust on T-cell data. And we all know that probably Pfizer gets out of the system within 6 months, and Pfizer has a challenge with the myocardium and myocarditis. And US FDA is investigating it when it got full approval, but it's the only vaccine in the world which has full approval. Moderna is closely following the suit. Both have impact on the Delta strain. These are mRNA backbone. India is making its own mRNA vaccine called Genova. The second group of vaccines are Adenovector vaccines, which means Covishield or Astra, Johnson & Johnson single dose, or Sputnik with 2 adenovectors which are human. These are on the adenovector. They do not have very good immunogenicity, but that T-cell response is supposed to be better. That is what is there in that. And the third group are killed vaccines, which are like Covaxin. And the fourth group are subunit vaccines like Novavax, Covomax. And the fifth is the Zydus vaccine, which is DNA, which is Indian equivalent of mRNA. Each platform generates a humoral response and a B-cell response.
humoral response as neutralizing antibodies, B cell response, and T cell response as T cell development or interferons. All this is a very complex process, but it stands to logic, Rahulji, that vaccines are based on three things. Each country has a vaccine policy. Second is each country has vaccine availability, and each country has a vaccine access. So the public health specialists of that particular country will decide based on the availability, access, data, equity, what vaccine, how, and when. So mix and match was tried in peaks of the pandemics, like UK and Spain, because they wanted to cover most of the people very quickly, and that is why they used it. In India, however, we have not done that. In India, we have some time for that. And in India, it is unlikely that Government of India will recommend a mix and match policy. Till such time, more vaccines will be made easily available. And that is something which is important for us to understand. I know I took a little extra time, but it's something which we need to recognize better and we need to handle it better. So Rahulji, my counter question to you on this matter, and because today's topic is immunity and vaccines, is that, you see a lot of population with monoclonal antibodies. Now, initially when the monoclonal antibodies were launched, they said it could be used for prophylaxis or they could be used for the first 72 hours. But recovery trials showed some data that these monoclonal antibodies can be given later. How useful and impactful are they? That's number one. And number two, Rahulji, my question to you is that what is the likelihood of the third wave now, with the cases declining across India, with the festive season particularly happening, the Ganpati season, the various festive season happening, lack of social distancing, lack of masking. And you made a very pertinent point that the strongest vaccine today is the mask. So Rahulji, if you could tell everybody your thoughts on monoclonal antibodies in the ICU setups. And second is your thoughts on the third wave.
Thank you, sir. So there is this platform which is called as recovery platform, which has been created in the United Kingdom to study all the therapies which come across for COVID-19. And we've had very good results. In fact, the steroid trial which came out was the recovery trial which came out initially. Similarly, they also did a plasma trial. Of course, the Indian trial was much bigger than theirs. The third one was they did a good trial on tocilizumab, and they came out with a study that which showed that tocilizumab has some merit in it if it is given within the specified time. And now the fourth one which they have looked at is the use of the casirivimab, indivimab monoclonal antibody cocktail to be given in patients who are hospitalized. Remember, the emergency use authorization of this monoclonal antibody cocktail was only given for patients who are not hospitalized, who are above 12 years of age and 40 kilos, and who have some form of a comorbidity, which includes age, obesity, heart disease, diabetes, hypertension, immunosuppressive therapy, liver disease, and kidney disease, who may be at a risk of developing a severe infection once they have contracted COVID-19. And it had to be given within the first 7 to 10 days. Initially, the earlier the better was 3 days. Then they did this analysis in a group of individuals who were admitted in the hospital, who were already requiring oxygen, either via just a nasal cannula or through patients who were already on high flow nasal cannula or by an IV or ventilator. And they gave a very high dose. The trial studied a dose of 4 grams of casirivimab and 4 grams of imdivimab. Remember, the dose which we are giving is 600 milligram of CAS and 600 milligram of MD, which combined makes 1200 milligram. Here they are giving 8,000 milligrams, which is 8 grams of this dose, which is almost 7 times higher than what we are giving. And that makes it extremely expensive. Then what they found out was that there was a 20% reduction in absolute mortality in this group of patients when compared with the placebo. So definitely, I think a mortality reduction in 20% is a very, very good mortality reduction, which they found in this group of individuals who were requiring oxygen. But they had to be given in patients who were seronegative. That means that you have to do a serology of these patients. And if the serology of this patient shows no presence of nucleocapsid antibodies, then you can actually give these patients a dose. However, in India, the practical problem which comes across is that even if you adopt the trial results, first of all, the EUA has not been given for these kind of patients currently by the government of India. Secondly, the dose makes it almost impossible to make it equitable to anybody. So what people may do is they may choose to give 1200 or 2400 milligrams, which is the one vial which can come as 2400 milligrams, and hope that the results would be same. And they are now looking at a much lower dose to sort of counteract and see whether the antibody is going to work in the similar way when given in lower dose instead of a higher dose. And right now, I think it's a very, very heartening news that there is a good trial which shows a 20% reduction in the absolute mortality, 20% reduction. It's not a relative risk reduction, it's a 20% reduction in the mortality in this group. The monoclonal antibody probably are here to stay. I think as there is another group of antibody, bamlanivimab, and another one which is going to come across very shortly. And if that comes into India and the world, we will probably see, hopefully with the competition, some price correction as well. And if that price correction happens, it may become equitable for everybody in the country to actually have it. Coming to your second question, sir, about third wave. I think none of us have a crystal ball, but the way the country is going right now, every single day, the thick tail, and the thick tail terminology is coined by Dr. Shashank Joshi. He is the one who has actually used this word first time. And this thick tail, though it has become longer and longer now, it is definitely narrowing down. It is definitely going down. And I think whether you look at Maharashtra or Kerala or the other 4 or 5 South Indian states, we are now looking at a test positivity rate of less than 1% or around 1% in some of the states. And Kerala is definitely now correcting itself and coming closer to that 5% test positivity rate. But remember, admissions in Kerala are not much. The healthcare system is not overstretched because of that. So I believe the third wave probably will not touch us into the same gravity as the second wave did. It may sort of come as a culmination of the second wave, just continuing on and on with a few blips in between. And it is in our hand to make sure that this country does not see a third wave by keeping ourselves vaccinated and having the COVID appropriate behavior going on. If we are able to push, and this is purely my view, sir, correct me if I'm wrong, the normal 100-day cycle, if you are able to push it to 200 days or 250 days by very good behavior, which is around 6 to 8 months, I am asking, trust me, COVID by next April then will not become a problem for us day to day. April to June, July next year, we will probably be living a reasonable normal life with COVID not causing any disruptions. And by disruptions, I mean lockdowns, school shutdowns, so on and so forth. We will all be able to have a good livelihood. We'll all be able to get our kids educated. We'll all be able to go out and travel and do things what we do. But the COVID appropriate behavior in form of mask will continue, because by that time, majority of our population will be vaccinated, and there would be two who would probably have 2 vaccines as well. I'm sorry I took a little bit of time, sir, but I would like you to give your thoughts on this as well. And then Gloria Miller has put out a interesting question that COVID-19 vaccines have approximately 100 times more reports of death per year than average reports of other vaccines. And unless we put medical freedom into the constitution, the time will come when medicines will organize into an undercover dictatorship. I think these are the words by Benjamin Rush. So she's trying to sort of correlate and say that are we actually giving a more harmful product to our citizens than what should have been given? A difficult one to answer. But
no, I am very clear about it. I think that is a little miscued version of this thing. These are these anti-vaxxers as a group, and they feel that vaccines do more harm than good. Data worldwide is very categorical. US population which is unvaccinated is driving the pandemic there. Children who have not got vaccinated are driving the pandemic there. So vaccines save lives, and vaccines save you from critical disease. But current vaccines are emergency use, and they are not perfect. They have a long way to go. And vaccine safety is important. But I don't agree that vaccines have related to, a preponderant, a lot of deaths, etc. I don't agree with that statement at all. I also do not agree with the fact that we should not vaccinate. In fact, we have started to move around the world in a little better environment, because of vaccines. But I agree with one thing, that the strongest vaccine is not a vaccine injection at all. It is the mask and double mask. Having said that, US, etc., they are not even doing the mask and they are not even doing the vaccine. And that's disastrous. According to me, we should do both. Yes, some individuals who have underlying disease need careful consideration during process of vaccination. So there is a possibility of an adverse event. For example, if you're allergic or you have developed serious allergic reactions to any substance or a drug, then vaccine is contraindicated, and the only way they can handle this is probably to ensure that they double mask appropriately. So that is as far as the vaccination deaths are concerned. And I don't think that there is any cause of alarm, because the number of deaths COVID has itself had is humongous, particularly in United States, Europe. In fact, India has one of the lowest case fatality rates on planet Earth. So I think it is very clear that vaccinations save lives, and it is also very clear that vaccinations save you from serious disease. Having said that, vaccines need scrutiny, vaccines need pharmacovigilance, and vaccines need to go through the regular mandate. That part I would completely buy in, and therefore, rather than driven by pandemic panic, we need to be driven by strong pharmacovigilance and strong science. And in next generation vaccines which we will get, it's a process in evolution, will have the scientific rigor and scrutiny for safety much more than efficacy. And I'm very, very certain that that shall happen, and that will be the standard of care and the order of the day. So that is how I would like to take that question. The second thing is about the third wave. The third wave is predicted to come in India between December and January. But festive seasons and spreader and super spreader events, congregations and crowds, and if there is a new viral strain which breaks out, could again get into a challenging situation. So this is something which we have to be ready for. But currently our mantra is simple. Dr. K.K. Agarwal always said that do your double masking, do your simple, beyond masking, do your distancing, and ensure that beyond distancing and masking, ensure your hand sanitization, avoid crowds, and ensure that you are in a well ventilated place. If we have this patch like 5 fingers and do it well and top it up with an appropriate vaccination, I think this could be the thing to handle COVID. We have to live with COVID. COVID has not yet become endemic. Again, a lot of people are hypothesizing that COVID is on its way to endemicity. And as we end our show, I am very, very clear that COVID immunity, herd immunity is a myth. And I'm going to ask this last question to Dr. Rahul Pandit ji, and then he will wind up. Ki herd immunity, initially we said to be COVID free was 60%. And now the target has moved almost to 90 and 100%. So Rahul ji, what would be the right percentage of herd immunity, particularly in India? And when will we have that? And do you really believe in this concept of herd immunity? Because today's topic is immunity and vaccine. And that's why we have not taken a lot of viewer questions. And we are focused on more of vaccinations. So we probably will have natural infection, which will be subtle. Many people don't know that they got exposed. Some people get symptomatic infections. And then we have a third group where there is vaccines. And some people get a little bit of both. Some people don't know they had COVID and they took the vaccine. Some people know that they had COVID and then took the vaccine. And some people never got COVID but have taken the vaccine. These are three different categories. And each of these categories have some degree of protection. Probably the people who have got COVID with vaccine probably will have much more protection, at least for a year. So Rahul ji, your final word on herd immunity, your final word on hybrid immunity, and your take-home message for our viewers.
So I completely agree with you, sir. I don't believe in this concept of herd immunity, because it looks like every living individual on this planet Earth will have to have some form of antibodies present in them, either through the natural course of disease or through the vaccination. And it will probably happen in pockets. It's not going to happen everywhere at once. It will probably happen in pockets within the country. It will happen in pockets. So my belief is that right now the best vaccine is the vaccine which you take along with the mask and double mask, and that's the most potent way of staying and keeping yourself protected. The concept of hybrid immunity is very, very important. Those who had COVID or those who had a subclinical infection of COVID who have never really found out that they were COVID positive, they certainly have a better T cell response and the immune response, and the antibody does not go down, the decay does not happen very quickly in them. And my last few words to all of them for today's show would be that please keep yourself protected. Please wear your mask. When you're stepping out of the house, wear a double mask. Do not go and test your antibodies blindly and start believing those commercial antibodies, because most of them are not done as a part of a research project. They are done as a part of a commercial process. And it is only the neutralization fraction which actually only very, very few labs do it. And most of them don't do it as a commercial project. Will actually tell you what is your T cell response and how well your antibodies are neutralizing. So please don't believe into antibody number and drop your guard. If you drop your guard, it's likely that you will catch an infection. And if you are vaccinated, then you would probably be giving it into somebody else, because you may have a very, very mild or subtle infection in terms of symptom, and you may probably not wear a mask and give it to your friend. So please wear a mask, get yourself vaccinated, don't test antibodies. Thank you very much.
Thank you and namaskar. You are watching Dr. KK's MEDTalks non-stop live, and this was the 427th version of Dr. KK's MEDTalks. We'll meet once again tomorrow with another KK MEDTalks, and we all fondly and cherish the memory. The show must go on of Dr. KK Agarwal.